Saucier, host of the Cycle Power Summit 2019, and I am here in this session with Chavah Brooke. Chavah is a birth doula and childbirth educator with a particular focus on the role of past trauma, including sexual assault and childhood sexual abuse, and its impact on childbearing aged women, specifically during family planning, pregnancy, birth, and the postpartum period. Chavah, thank you so much for joining me for the Cycle Power Summit.
Thanks, Anna. I'm really excited to be here.
Awesome. Chavah, this particular focus and work is so very important, but a conversation that most people have rarely heard anything about. Can you share with us a bit of your journey focusing on the effects of past trauma?
Yeah, I'd love to. I do want to start by just acknowledging, and you did too, that the nature of this interview and the things that we're going to cover can be difficult. And so for those of our listeners who are listening, sometimes it's worth getting in the right place and mindset to listen to some of these things. My intention is to be very sensitive to this topic, but also very clear and concise in some of the examples that we're going to go over, so that it can be as most beneficial to our listeners, both women who are using fertility awareness-based methods and for practitioners or educators who are teaching the method. So just putting that disclaimer out there initially.
Absolutely, because you know, if a listener maybe has experienced this themselves or somebody else, and so from coming from both of those sides, it's important to be sensitive about that.
Absolutely. So a little bit about me and how I got into this area of interest. So I became pregnant with my first child in 2011, and started doing all kinds of research on, okay, what next? My background is in psychology and research, and so I love doing my own research. Ended up going the route of a home birth with a midwife. And when our daughter was born in 2012, the midwife we were using was needing an assistant. And so she and I got along well, and I started apprenticing with her and learning how to become assistant for home birth. And one of her passions was trauma-informed care, which is medical practitioners and doctors, just midwives being aware of how trauma can impact women, specifically when it comes to medical procedures. And so she instilled this passion into me on understanding and just being aware of how this can impact women. And so I just carried on that work in my doula practice, in my childbirth education practice, and now as a fertility care practitioner. So,
yeah, thank you. Thanks for sharing that past. It's always interesting how we come into those things. I had my two babies at home too.
Oh, yay.
So what then are let's talk about some of those examples of how past sexual trauma can affect a woman's experience learning a fertility awareness method, and the things that we need to observe and do while learning that.
Absolutely. So I am a big believer in mindset and how our emotions and our history and how our mind is held in the body. And there's a lot of research to show that we hold memories in our body physically. And so some of the women I've worked with can get really frustrated when they think about those who have done a lot of healing around sexual abuse trauma. So looking specifically at childhood sexual abuse or sexual assault, they can become frustrated with, I have worked really hard to heal on this. I've gone to therapy. I've done a lot of healing. Why is this coming back up? And a lot of times the reason, and for some women, they just haven't dealt with it at all. But one of the reasons I believe that fertility awareness based methods could be somewhat triggering and bring back a lot of these past events is because it's very body focused. This is positive and negative, right? So just in the word fertility awareness methods, we're asking you as educators, or even if you're just doing this yourself, we're asking you to really connect with yourself in your body. And for a lot of women who have undergone trauma sexually, they have disassociated from their body. They've disconnected from a lot of themselves physically. This isn't a bad thing. It's actually a really powerful protective mechanism to be able to pull away from your body. For a lot of women, and it doesn't even have to have trauma in your past, but especially if there's sexual abuse, have kind of this distorted self-perception or shame or guilt associated with their body. And so when they decide to start a method where we're saying, we really want you to tap into what you are feeling as a woman and what your cycle is, it can really pull into that mindset and ask you to stop disconnecting in places that you didn't even realize you've disconnected from. So one specific example, so that's kind of mindset, but one specific example, most of the methods out there want you to pay attention to different biomarkers. And a lot of those are body secretions. So whether that be mucus or menstruation or abnormal bleeding, these are all things that you need to tap into and be really aware of. And some of the methods are all external based, but you're still observing secretions on tissue, or some of them are internal. So you're actually having physical touch to your body. And it may be too that initially when you start fertility awareness, you may not make any associations at all with your past history. But as you really start to listen to what your body is doing and really start to remove those barriers that just culturally we've kind of set up, where we just don't understand anymore what our body's doing.
Yeah, we're seeing it as a negative thing automatically. That's annoying period and this annoying mucus and stuff.
Right. And now you're starting to have to pay attention to it. And it's like, wow, I am so disconnected from who I am as a woman. Why is that? And for a lot of women, they start to explore it and they realize it's not just a cultural disconnect. It's not just, oh, you know, I've been on the pill and my period's gross and da 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 da. It's, wow, I really don't know who I am, like my body at all, because of X, Y, Z. And it starts to uncover some of those things that you either haven't worked through or you thought you dealt with, but now you're expected to look at yourself different again.
Or maybe possibly didn't even realize was there in the first place.
Yeah. Even realizing what's not. Yeah, that's right.
It wasn't one of the, like a huge trauma, but there can be other smaller traumas, right? That
Absolutely. And that's something that comes up a lot in the work that I do with women, specifically in preparing for birth. I work with moms who have had past trauma and how that may impact them during their birth. Birth is a very physical situation, and a lot of those body parts that you're using for birth were also potentially utilized during the abuse. And so those body connections come back online that you've pulled away from. And so women start having flashbacks and triggers to abuse and things they didn't even realize existed. And I think this is I think that we as educators and women, as we start to explore this more, will find that this is also possible when we begin becoming more in touch with our bodies in a fertility awareness-based method way. Especially And I've worked with a mom specifically that this came up with in regards to abnormal bleeding. So the method I teach is all external observations, but did a wipe and looked on the tissue and saw blood unexpectedly. So it wasn't during her menses time. There was unexpected bleeding. And it took her back to a time where she had seen bleeding and was an immediate trigger. And I thought, okay, I hadn't thought of this in relation to the method I was teaching versus in birth, where blood is a very, natural thing that you're going to see. Yeah. And expected. So I think the biggest thing as we work through today, Anna, is helping women to be aware of where potential triggers might lie so that they don't come so unexpectedly. It's the unexpected that is really traumatizing. It's a lot easier to, for example, if I talk about the woman who saw the unexpected bleeding, if she had seen that and thought, and then was able to quickly say, oh, I've heard this before. This is okay that I'm feeling this way. This is okay that these emotions are coming up for me. I can deal with this, versus having no knowledge whatsoever of this idea and being hit with it and, oh my goodness, in complete meltdown mode. So the more we can educate ourselves, the more we can educate others, and the more those who are educating women specifically know of these things, might be able to head some of that off.
Yeah, that's a fascinating observation, because I think we can kind of loosely look at, okay, we're learning fertility awareness method, you're learning NFP, but really it's, we have to accept the fact that our body is going to start telling us something that we don't know yet.
Yep,
and so it's almost kind of an acceptance of, especially if you've had the feeling before, maybe like your body has betrayed you, in these situations, then now we're accepting it as something I don't know, something I'm receiving from it, some language that it's communicating to me. And I think when you were talking about those triggers, like about the blood or something, so that now when something comes up that's unexpected, it's like, it's a whole other control over me again. My body's
yeah,
that's at me in some way.
That's right. And even, that's exactly right. And even, it doesn't even have to be bloody. Just when you're starting to even come to the realization that your body is giving mucus during different stages, or maybe throughout, even just knowing that your body can communicate. And like you said, I've been offline for so long. What have I missed? What's my body already tried to tell me? What have I disconnected from and shut off?
Right. So then when we're talking about women and couples who have suffered infertility, whether they have diagnosis or not, whatever they're going through, how does this trauma play in with them?
Yeah, I think that's a good question. And I do think that there are some distinctions, but some overlaps too, between those who are just trying to achieve or avoid and those who have infertility. An interesting thing is that studies show there is a higher correlation between women who are diagnosed with unexplained or unknown infertility and a history of sexual abuse.
Wow.
And
I didn't know that.
Yeah. So the question is why? And there's not necessarily an answer other than I strongly believe that, like I talked about earlier, trauma, our experiences are held in our bodies. Mm-hmm. And if you're thinking of something like a sexual trauma, sexual abuse, assault, that's very much connected to who we are as women. That trauma is in the same area that we need to be able to achieve a pregnancy. And so I think that there's a lot to unpack there. And I wanted to say earlier that statistics show that 1 in 4 women, up to 1 in 7 women, have undergone some type of sexual trauma and abuse. That's a high number. And that's trying to take into account those who don't report, or, there's a lot of uncertainty with that. But I want to say that means women who are struggling because of past abuse, there are a number of them, and they're not alone. And when it comes to infertility, a lot of times couples, and especially women, feel they're alone in this. Yeah. And if you are someone who has trauma in your past, sexual abuse, sexual trauma, that was another time that you felt very alone. Another time that maybe you tried to talk about your abuse or tried to disclose your abuse to someone, and you weren't heard, you weren't listened to, you were kind of pushed aside. And I think women who struggle with infertility sometimes have those same feelings. Like, this person has no idea what it's like to not be able to have a child when that's the one desire of my heart, like, that I want so badly. This person has no idea when they say to me, this doctor, oh, well, we'll give it 6 more months, or, 1 more loss, and then we'll take a look at it. And these phrases and terminology that's used can really trigger back to a time when you may have tried to tell someone about something that you were experiencing, and you felt like you were just pushed aside or disregarded, or, again, wow, I'm alone in this again. And there's so much overlap in these areas. And these ideas that my body is betraying me. Like, all I want is to get pregnant, and I can't get pregnant. What's wrong with me? What's wrong with my body? Why is it responding this way? And those are can be very similar thoughts and feelings to if you were a child and were being abused and just having confusion and not knowing what's happening and being misunderstood. You're taken to the same place. Our brains, we're amazing creatures, but when it comes to emotions, it's the same part of your brain that's firing for these emotions. And so even though you logically as an adult can think, okay, this is different than that, but if you're feeling that shame or embarrassment or confusion or fear, those same regions of your brain are firing. And so I think that's where the connection with our bodies come in. And so if you're talking about someone who has this unexplained infertility or unknown cause, that maybe there is a tie back to, something in the past.
Yeah. Yeah, which is certainly not to say, I just want to make sure for our attendees here, that not to say that if you're suffering infertility that you have had past trauma, right?
Yeah.
We're definitely
absolutely.
That.
I'm glad. Yeah. And not the other way too, is that you may have experienced trauma, sexual abuse in your past, and this will have no effect on you moving forward in the fertility awareness based method. It's just something to be aware of. And there's just correlation shown between the infertility and the sexual abuse. That doesn't mean it's causation. So there's many other factors there. Another thing to think about is women who are struggling with infertility are much more likely in their journey to have to interact with doctors on a more regular basis and try and get help for the infertility. For a lot of women who have undergone abuse, authority figures can be really hard to work with, because for a lot of people, the majority of abuse comes from those and a lot of times it's a situation where it was a caregiver or an older brother, a father, and they were an authority. And so when you go to the doctor who's also an authority, you can get those same feelings of just fear and uncertainty and not wanting to speak. There's a lot of similarities there.
Yeah, and an authority over your body, nonetheless. They're telling you things about your body, and you're sharing things about your body.
Which is why a fertility awareness-based method can be so empowering, because you can take that control back for yourself, right? And I wanted to touch on this towards the end of the difference between this isn't all negative. How can this actually be really healing? And this is one way that you don't have to have somebody else telling you what's happening to yourself. You can tell for yourself, like this disconnect you've had for so long, you can get rid of. This inability to know what your body is doing, you can get rid of that. And those are the steps towards healing that can really start to transform in your healing journey. Another area that women who are struggling with infertility or not are going to encounter, and we all do as women, is vaginal exams. So any type of annual exam, vaginal exams, this can be a very triggering time. I mean, it's an uncomfortable time for any woman, let alone someone who has trauma in these areas. And so one thing is to try and find a doctor who is trauma informed, meaning they are aware that 1 in 4 women have had experience in their past of sexual trauma. And so they know how to work with a woman through something like this. But other tips is to take someone that you trust and you feel comfortable with and safe with to the appointment or exam with you, so that they're there and you never feel alone. Also, you can choose to disclose your abuse to your provider. This is a little bit harder. A lot of times it's for those women who have really started to work through their history, but it can be very empowering and healing to be able to say, I just want you to know that I do have trauma, sexual trauma in my past, and what I need for you is to XYZ. Mm-hmm. And usually what women need for their doctors to do is to be very clear about what you're doing. Step by step, walk me through what this exam is. And while you're doing it, tell me what's happening.
Mm. And why you're doing it too, huh?
Why you're doing it. That's another thing. What exactly is happening? Why is it happening? What's the point? And that can be really helpful in undergoing just a completely uncomfortable situation all around.
Yeah, sure. I love what you said about, we talked a lot about how learning a fertility awareness method can be triggering of past experiences, but that this can actually be a part of the healing process. And if we're able to recognize those triggers and somehow work through them or be guided through them, but what might that look like?
Yeah. So one thing I want to talk about is, as we've all heard the term survivor, and it's a very powerful word and a very true word, that if you have come out the other side of sexual abuse or trauma, then you are a survivor. But there's some research starting on post-traumatic growth. So a lot of research up to this point has been like focused on the trauma itself, or you've heard the term PTSD, post-traumatic stress disorder. How has this trauma impacted you negatively? And what should you be aware of? And so we've kind of covered some of those things up to this point, but what do you do now? And there's a lot of research looking at, once someone recognizes the trauma and sees it and can say, I'm a survivor of this, now you can start to grow. And this trauma didn't just negatively impact you, it actually has grown you more than someone who hasn't undergone this. And so research is showing that there's 5 key areas for women who are known as thrivers versus just survivors. Okay. And what is that research showing? It's showing that women who have come to terms with their trauma, they have an enhanced sense of personal strength. So they know they have the ability to move forward. They have improved relationships, which seems a little like, really? Wow. Like that's really key, especially in a method where we're asking you most likely to communicate with your partner about your cycle and your fertility and your body, that you can do that. And in fact, you may be able to better do it than someone who hasn't had these experiences. There's also number 3 is a greater appreciation for life. Number 4, the ability to experience new life possibilities. And then they also find that women have a deeper sense of spirituality, of a higher being, or just feeling more connected to others, to the earth. In some way, they can relate to something beyond themselves. So how does fertility awareness based methods help you to become a thriver? Like, I think that this ability to really tap into who we are as women, and know that we can control ourselves and our bodies, or start to have control over what our body is telling us, when for so long we've shut that down. That, wow, that's pretty amazing. It also allows us, for most women who come into awareness-based methods, they're looking to either achieve or to avoid a pregnancy, and that's centered around sex. When are you going to have sex? When are you not? And it gives you language to be able to communicate with your partner, with your husband, with your spouse about sex. And for a lot of women who have sexual abuse, sexuality is something that's been completely shut off. And now we're going to start giving you the terminology and the language to be able to communicate about your sexuality and have control over, yes, now is a time that I am ready for sex. And no, now is a time that I am not ready for sex. Mm-hmm. And knowing that that's okay, however you choose to do that.
Yeah, that the conversation around sex doesn't happen very frequently. I think our society tends to see it as something that actually shouldn't be talked about. Like we move into it, it's an emotional experience. But I think especially those of us in fertility awareness industry, teaching and stuff, we can see the power of that conversation, how much it strengthens those relationships. And I find that fascinating, especially in terms of past trauma, how bringing that back to being a conversation instead of something that is like controlling, or one person initiates and one person follows, but rather it truly is a conversation.
Yeah, that's exactly right. And even, on a little bit deeper level, is when you are in a loving relationship with your partner and you have the ability to say yes or no, and that be accepted. It also allows you space and freedom to explore times that you weren't able to say yes and no, and that response be respected. And I think that that's worth mentioning, to know that when you begin to realize you have this ability to own your sexuality, that's when you may be struck with, wow, there was a time where I didn't have that. And it can be very painful, very hard to realize. And your husband or spouse, partner, may be the first person you ever tell, that this has happened. And I don't know beyond that what I have to say, other than I just wanted to point that out.
Yeah. 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 What an incredible conversation. Thank you so much, Chavah. We get to wind this up. I feel like we keep talking about it, but thank you so much for sharing all that knowledge. There's so much to think about and unpack here. As we close up, we're asking all of our speakers to share, since we are the Cycle Power Summit, to share your number one cycle power tip. And we weren't necessarily talking about menstrual cycles here, a little bit, but I think we're talking about something even more powerful, like understanding the language of our body. And so what would be your number one tip coming out of this whole conversation?
Yeah, my number one tip is, and this may seem a little counterintuitive, but I encourage every woman to begin to connect with their body in a physical way, and do that by something called abdominal massage, where you are actually connecting with your own hands to your stomach, and allowing yourself to be connected to that part of your body. And this goes back to that disconnect that for a lot of us who have abuse in our past, we haven't been able to really connect in. And when you're starting into a fertility awareness based method, you're connecting to a lot of places on your body, but a lot of times your abdomen and your stomach is not something that is talked about. And I think it can be really powerful and healing to do these abdominal massages. Make it a part of your evening routine. And it's what it looks like is you just, laying in bed, or you can do it in the mornings when you get up, sitting up straight and applying a little bit of pressure to your abdomen, and just breathing in and out and really massaging that part of your stomach and belly, and not have negative self-talk. Oh, I wish I was skinnier. I wish I could have a baby. I wish, but just saying, thank you for allowing me to connect with myself, and really thanking your stomach, thanking your body, thanking your cycles, and becoming more and more who you're supposed to be.
Wow. That's amazing. Thank you so much, Chavah. Thank you for joining me at the Cycle Power Summit.
Thank you, Anna.